we're going to talk briefly about eyes and ears. You'll have to excuse my ugly PowerPoint title slide there. I kind of picked out the PowerPoint slides that I wanted to go over. Too much information to go over everything in the chapter, so we're going to focus on what you're going to see most commonly, eyes and ears. You see lots of ear infections. I mean, 75% of kids that come into the pediatrician's office have an ear infection. So we're going to talk a little bit about that. We're going to talk about conjunctivitis and treatments for both. Okay, so eyes and ears, you've got about 3 things that can cause issues with eyes and ears. Allergies, bacteria, or viruses. Okay, allergies can cause allergic conjunctivitis. They can cause a lot of congestion and a lot of fluid to build up behind the ears. So treatment for allergies, antihistamines for the most part. Benadryl, Zyrtec, Claritin, those are all antihistamines. And they will help allergic conjunctivitis. They will help the symptoms of allergies, which could lead to ear infections if not alleviated. If it's bacterial in nature, you're going to need an antibiotic. And if it's viral, you're going to need nothing. You're going to need some pain control, and that's about it. So, signs and symptoms of conjunctivitis. Let's start with the eyes. Redness, edema, swelling of the eyelids, swelling of even the white part of your eye. So this can be pretty ugly. Makes my eyes water when I see some of the pictures in the book. Tearing, discharge, it may be clear, it may be very, very purulent. Eye pain, and usually the eyes with allergic conjunctivitis are very, very, very itchy. Different types of conjunctivitis. You can have bacterial. Your conjunctiva are very inflamed. You have that nasty yellow, sticky, crusty discharge. They kind of hurt. Eyelid edema, occasional, but your treatment is going to be antibiotic drops. Now, a lot of times it's hard to differentiate between bacterial and viral, so caregivers or care providers will sometimes just automatically treat these with an antibiotic drop or ointment. A viral infection in the eye, the most serious is a herpes infection. The herpes 2 virus, the same one that causes fever blisters, can get in your eye, and that's kind of bad. Sometimes you have to use an antiviral medication for that if herpes is suspected, but a lot of times it's just a viral infection, the adenovirus, the H. flu virus, different viruses. Now, if it's a bacterial cause, back up to that, and they are suspecting, most of the time it's staph that causes bacterial conjunctivitis, but if they're suspecting something like in a baby, like gonorrhea, they might do a culture. Allergic, you just have an inflamed, itchy, watery, clear, watery, stingy eye. Usually an antihistamine drop or just some saline drops will help with that. All right, let's go through the PowerPoint while we're going through go through the chapter while we're going through the PowerPoint. Again, here's your viruses and bacteria that'll cause conjunctivitis. Adenovirus is probably the most common viral infection of the eye. There's your pathophys. There's the same thing. All right. Oh, that picture just makes my eyes water. One thing about conjunctivitis, you got to do a lot of teaching. Bacterial conjunctivitis is very contagious, otherwise known as pink eye, by the way. It is very contagious, so parents, sisters, brothers need to make sure that they wash their hands very good before they apply medication and after they apply medication, because it can be passed from family member to family member. Usually they won't let them in daycare or school until they've been on antibiotics or antibiotic drops for at least 24 hours. Health history, you want to find out onset, if it started in one eye. A lot of times bacterial will only be in one eye, whereas bacterial and viral will only be in one eye. Allergic will probably be in both eyes. All right, you're going to make sure that you assess their vision. Some teaching that you can do with conjunctivitis to alleviate the symptoms. Warm compresses to loosen all that nasty crustiness. Babies are the worst. They'll wake up and their eyelids will be closed together, crusted together. So warm washcloth, and it's a tedious process. Very gently get that stuff off their eyelashes to open up their eyes. And you may have to continue to do it over and over and over. Make sure you tell them to use like all four corners of the washcloth when they're doing that, because again, it's very contagious. Don't use that washcloth on anybody else. That's where it talks about preventing infectious spread. Good hand washing. All right, we're going to skip through this next part, and then we're going to go talk about ears. Oops. Lost my PowerPoint. Sorry. Again, there's no way we can cover all of this information about eyes and ears. You're welcome to read through it for your own understanding and learning, but we are going to talk about what we see the most in the clinical setting. Otitis media, probably the most commonly diagnosis in pediatrics. Acute otitis media, otitis media with effusion, otitis externa. Those are the three things that we're going to talk, or the three types that we're going to talk about. Some common risk factors. The younger the baby, the smaller the eustachian tubes, the more trouble they have draining. So that is a risk factor. If they have allergies, if they have recurrent upper respiratory infections, daycare, of course daycare, but it also builds up your immune system. So I'm a daycare proponent. Previous episodes of ear infections. You know, these kids are usually the ones that are diagnosed with 5 and 6 and 7 ear infections a year. Chronic offenders, they usually end up with some tubes, which we'll talk about here in a second. If somebody smokes in the household, the passive smoking can irritate that whole, everything from the neck up is connected. So if the patient or the baby is breathing in all that smoke, it irritates those nasal mucosa, makes them swell a little bit, therefore the fluid behind the ear can't drain. That fluid just sits back there, and bacteria get involved, and they just eat up all of that fluid and grow and grow and grow, and they cause an effusion behind the eardrum. Babies are really, like when you bring them in, or when parents bring them into the office or to the emergency department, usually the chief complaint is fever, or they won't eat, or they're fussy, or when you lay them down they cry. When they take their bottle they cry. So think about all of those things. When babies suck on a bottle, you know how when you suck on something it kind of pops your ears? Well, that hurts, so they cry. Fever, of course. If they've been congested and have all kinds of nasty drainage, then all of that bacteria and mucus can sit behind that eardrum and just build up infection. So pain is usually crying, not eating, what we see infants with. Older kids can tell us, hey, my ear hurts. Even teenagers that get ear infections, they can pretty much localize that pain. Sometimes we don't know that a patient has an ear infection until the tympanic membrane ruptures and we have drainage. So that can be a presenting chief complaint as well. All right, some complications of otitis media: hearing loss. If you have continual rupture of those tympanic membranes, then you can lose some elasticity, therefore have some hearing loss. If you have a large amount of fluid that builds up behind the ear, that stops the sound conduction, so you can have hearing loss because of that. If you do have hearing loss from chronic ear infections, you could have some speech delay. So best to get it treated and taken care of early. Usually they end up with, like what I said, they end up with a set of tubes, and we'll talk about that. The eardrums get scarred. Mastoiditis is definitely a complication, and it's a pretty serious complication. The bone right behind the ear can get infected with the bacteria that infects the eardrum or behind the eardrum. So Mastoiditis is definitely a hospitalizable offense. Bacterial meningitis, that's one of the reasons why we treat ear infections like we do. In Europe, they don't treat ear infections until the tympanic membrane ruptures, because most of them are viral. About 75%, I think it says in here, are viral in origin. It's so close to the brain and so close to that mastoid bone that the guidelines say, you know, if it's this and this and this, we're going to go ahead and treat it with antibiotics. It's going to get better either way. It's going to get better if it's bacterial. It's going to get better if it's viral. So the overuse of antibiotics probably is mostly related to otitis media treatment. Okay, some viral causes, they do resolve spontaneously. They take, 3 to 5 days to kind of run the fever. Bacterial causes may require treatment with an antibiotic. Usually, if the patient has an ear infection, they're going to get an antibiotic. There are parents that do buy into the wait and watch regime, so that's good if you make sure you give them all of the information what we're watching for. Increased fever, pain behind the ear, coarse purulent drainage. Those are all things that say, hey, we may need an antibiotic. But if we can just wait it out and a viral cause kind of resolve on its own, then that works as well. Good teaching is the key to the wait and watch idea. All right, so here's some things that you might see the patients present with: fever, ear pain. Let's see, we just talked about all this. Poor feeding or loss of appetite, difficulty sleeping because when you lay down, you put pressure on that eardrum, hurts. There's some risk factors, and then there's some more risk factors. All right, there's some pretty pictures. This is what on the right. This is what an infected ear looks like. You guys probably won't be looking in ears, but if you ever get the opportunity, that's a pretty good ear infection. This on the left is a normal ear. You can see the little bones behind there. You can see the appropriate amount of fluid. All right, so pain control. Pain control and fever control important in otitis media because babies won't eat if their ear hurts, so you need to make sure you manage their pain. Prevention, a good decongestant if they are an allergy baby and have a lot of fluid build up behind their ear. Smoking. Make sure that parents know that even passive smoking can result in increased incidence of ear infections. Okay. Otitis media with effusion is basically just a buildup of a lot of clear fluid behind the ear. Risk factors, probably the one biggest risk factor is allergies. And so if patients have allergies, they frequently have a lot of fluid behind their ear, which can increase their risk of an ear infection, a middle ear infection. So to get that fluid out of there, a good decongestant might be in order, or some antihistamines to control their allergy symptoms. I'll let you read through the boxes there. Okay, tubes. Let's talk about tubes. All right, so if there's a lot of pressure buildup and the eustachian tubes are just so irritated that they cannot drain all those fluids, got to go somewhere, right? So they put in what's called PE tubes, or pressure equalizing tubes, into the tympanic membrane. Now they usually insert these about 6 o'clock if you're looking at it like a clock. And as the eardrum replaces itself, it rotates that tube kind of up towards the top. So they're very, very effective when they first put them in, but they become less effective and they kind of inch their way out as that tympanic membrane is replaced or regenerated, and it kind of moves it to the top. So they eventually fall out. If they last a year, that's fabulous. That's usually about the max. Okay, I've had some that have stayed in years and years and years, but that's totally not the norm. One thing you have to do a lot of teaching with when they do have PE tubes in is can't get nasty water in there. So baths where kids lay their heads down in the water, no. Swimming in lakes and even pools. they need to have in some earplugs. Okay, so that's a teaching point that you need to teach parents. All right, speaking of swimming, in the summer we see a big resurge in, oh, here's some more pictures over here. Yeah, it's a color picture of that one. That's awesome. Okay, so in the summertime, lots of kids swimming. So they have water that stays in their ear. That water can grow some fungus and cause otitis externa. Painful, painful, painful. Swimmer's ear is what this is called. Basically, that flora, that fungus grows in the outer ear, excoriates the ear canal. It is very painful to touch. I've seen some horrible otitis externa infections. Treatment for this is an antifungal ear drop, but sometimes that ear canal is so swollen that you can't get any medication down in there. So we have to put a wick in, and that can be super duper painful. So we take a tiny little piece of cotton, stick it in the ear, and we apply the medication to that wick, and that wicks it down, and it treats the whole ear canal. But installation of those wicks, it can really hurt. So if you ever have to do that, just know that it's a painful process, and you might need to pre-medicate with some pain medication and have some holding help if you are doing that to a 2-year-old. Pain management, again, very important. Now, there are some things that you can, down here, preventing otitis externa. These are great teaching points that you're going to probably use this summer. You may even use them yourself. Wear earplugs when swimming. Ear canal dryness. Okay, these are different ways you can dry your ear canals. Drying using a hair dryer. I've seen it done. Half rubbing alcohol, half vinegar. Put that in the ear canal. Let it run out, and it kind of dries that out. Now, if a child already has a little bit of irritation in their ear canal, do not use this method. Okay. You know what alcohol feels like if you pour it on a cut. So that's what it feels like. So I would not recommend that if the ear canal is already affected. All right, but dry ear canals is the key to preventing otitis externa. All right, that's all I've got on eyes and ears. You will see a lot of ear infections, so know your teaching points. Know about prevention of ear infections. Know why we treat them. And know that not treating them is an option if you have a parent on board that you trust to do the whole watch and wait thing. All right, y'all have a good day.